Welcome to the Imperial Sports Knee Meeting podcast. My name is Ernest, and I'm going to be your host for today. Before we get started, I want to tell you about our upcoming conference in 2026. It's going to be on the 14th of January, held at the Royal Society of Medicine in the heart of London. Registration will be open soon, so keep a lookout on our website at www.imperialsportsknee.com, or you can follow us on any of our social media channels at Imperial Sports Knee. We look forward to seeing you there. Every conference has a story, a moment where great ideas start to take hold. And for the Imperial Sports Knee Meeting, those ideas culminated in our first conference in 2025, which was a huge success. And in our episode today, I want to take you back to the start, where these ideas started to take root. I'll be asking the two people that were integral in making those ideas happen what it was like to start a conference, what were the greatest joys, and what were the most heartbreaking difficulties. And we'll end the episode looking at what's ahead. What can we expect for the conference in 2026? So without further ado, let's dive straight into my conversation with Associate Professor Mr. Chinmay Gupte. Hello, everybody. Welcome to the Imperial Sports Knee Meeting podcast. My name is Ernest, and I'm going to be your host for today. And I'm so honored to have in our studio one of the UK's most sought after soft tissue knee surgeons, Associate Professor Mr. Chinmay Gupte. And Mr. Gupte, he is not just one of the most well-known soft tissue knee surgeons, but he's also an associate professor at Imperial College. Your passion goes well beyond the operating room, from what I understand as well. You were the past president of the orthopedic section of the Royal Society of Medicine. You were the previous training program director for the Imperial College orthopedic rotation, and now you continue to push the field forward, being on the executive committee of the British Association of Surgery of the Knee as well. So, but you know what, to me personally and to all of us here in the studio, you are the brains, you are the passion, you are the vision behind the Imperial Sports Knee Meeting. So welcome to the podcast, Klaus.
And it's a great pleasure to be here, and thank you for all your praise and accolades. I'm not sure they're at all deserved, but it's very nice to hear them. No, it's an absolute privilege to be part of this meeting, which is very much the sum of all of its parts and more. So I'm delighted to talk about it with you and discuss past, present, and future as you've built it.
Yeah, exactly. I know that we've just recently finished our first meeting in 2025 in January, and that was a huge success. But if you can, I really want to bring our listening and watching audience, back to where this all started. I want to tell the story of how this meeting started from your point of view as well.
Sure. Well, it was driven by you guys, actually. So there were a bunch of trainees, as there always are, really interested in soft tissue knees, sports knee injuries, sports knee conditions and surgery. And they were asking me, when is Imperial going to do a sports knee meeting? And I said, well, look, there's lots of other meetings around. I'm not really sure we need another one. But there seemed to be a desire to have a meeting right in the centre of London with the best speakers covering a huge, vast amount of ground in sports knee conditions. And that was the carrot, if you like. It was the ability to deliver something that really people of your stage, senior trainees, junior fellows, consultants, with an interest, but perhaps not 15, 20 years of experience, all were clamoring for something right in the centre of London for the whole day that delivers on sports knee knowledge, conditions, improving surgery. The stick was that actually, for my position as associate professor at Imperial in musculoskeletal science, I've done loads of undergraduate training and undergraduate teaching. We've done lots of deanery teaching at the basic science, at the basic level, but there was a need, and as I said, a stick, there was an instruction to say, come on, you've got to do something for Imperial. We are world leading, actually. It's soft tissue knees.
Yeah.
We really helped develop quite a few procedures
Mm.
and implants related to it.
Yep.
So Imperial College wanted me to get this off the ground for
Mm.
those reasons. So lots and lots of different motivations.
Mm. And that's really great to hear from you. And, you know, I don't think many people have actually started a conference. And what was that journey like for you? Like, where do you start, I guess? What do you have to do to actually get this lifted off the ground?
Yeah, we've got a bit of time, so I'll tell you what happened.
Yeah.
I was revising for the FRCS Auth, which you know so well, back in 2007, 8. Actually, no, 2006. And I was trying to get on to an FRCS Auth course, Viva course. Couldn't get on. I was told I was on a waiting list. Then I was taken off the waiting list. And eventually we did it all ourselves here in and around Imperial, Charing Cross, St Mary's, Chelsea and Westminster. We actually organised our own little rotation for Vivas. And as soon as the exam was over, unfortunately I passed, I thought we've got to set up our own course. So we set up the first FRCS Auth course in London at Imperial back in 2007, the year after I qualified. So there was a history of fulfilling a need that was there in order to improve teaching and delivery of care. So it goes all the way back to then. And then I had that enthusiasm from the feedback we got from that. And really, it's been over a decade I've been wanting to do this. Again, because of all the things I mentioned before, centre of London, delivering at the level of the senior fellow, junior consultant, covering a lot of topics. So there was a need, and the beginning was really the vision to deliver something that was international or national to start with, and then going international, interactive, clinical based, and the sole aim of improving practice and creating crosstalk between clinicians. So we wanted to deliver that. Rahul Bhattacharya, who's absolutely key to the conference, was absolutely key in delivering the vision for the first one. We needed to get a timetable together.
Yeah.
We needed the speakers. Then we have to achieve some kind of funding from the sponsors. And all of that needs to be organized. So I had a bit of a track record in doing it.
Yeah.
And also, once you have the endorphin release at the end, when you think, wow, this has come off well, people in general have liked it, you want to do it again.
No, I understand. Oh, that's really great to hear as well. And was there something special about maybe perhaps 2024 and 2025? Because I just hear that, you spent a decade thinking about this. Was there something special about, say, that time of year where you go, this is the time we have to do it?
Yeah, I think lots of things came together. First of all, I needed to get a team together, and we've got a team. I know you can't see, there's lots of people in this room to help deliver this podcast. So we needed to get a team, and Rahul was absolutely key to that. Akib Khan, who's another one of our senior trainees, who's now at consultant level. We managed to get a team together, which took time because, again, it takes time to select people who can deliver. The next is we needed to have the run-up. And of course, being a cricketer, this is important.
Yeah.
We actually were going to do it in 23, but we realized we didn't have enough of a run-up. So we delayed it for almost 16 months to get the organization right. Because one thing that you do have to do is you have to get it right first time. And it takes a huge amount of organization. So I needed a team, the logistics, and then even the funding takes time to get. So that's where it all came together, and it wasn't coming together partly because of COVID and lots of other things, my time too. So it wasn't coming together before that.
No, fine. Yeah, and I mean, you mentioned a lot about sponsors and getting funding. I think that's quite a big part of a conference, isn't it? How was that aspect for you? Would you say that was like the most difficult bit Or would you say that actually it was all right because of who you are and what you've achieved so far?
No, it's not really to do with me, I would say. I think people look at the program, the speakers, the organizers, the location.
Yeah.
So again, it's that intersection of all of those things being at pretty decent levels for a first conference that entices people. Yes, there are some personal relationships, of course, having been as a consultant for nigh on 16 years, you develop some relationships around the companies and the implants. But I think it's actually the assurance of quality makes a difference. But yeah, it's hard. It's hard. But I'm very grateful to the sponsors for last year and this year.
Yeah. No, we've got excellent sponsors for the next conference coming up as well, which I think we will get onto later on here as well. And I just have a question about the name of the conference, the Imperial Sports Knee Meeting.
Yeah.
Why include the name Imperial in it? Was there a motive for that?
For sure.
Yeah.
I am indebted to Imperial College for giving me the opportunities it's given me for the last 12, 13 years. In fact, much more than that, because I did my PhD at Imperial in 2000. So 25 years of relationship with Imperial. In that time, we've conducted research that has changed practice internationally. We've been given the opportunity to do that. And the other thing, the talent in engineering, in clinical practice that there is at Imperial, I would argue you can't get anywhere else. And I'm sure lots of people would say, yes, you can, but I know from being here. So Imperial was absolutely key. In itself, it carries a mark of quality. And actually, I would say of the home consultants that we have from the UK, we've got a reasonable number of very high quality, high profile speakers who are part of the Imperial network. So for all those reasons, it was obvious that we needed to do this in conjunction with Imperial.
Fine. No, I think it's an excellent name. Certainly Imperial College carries an international reputation. And with the speakers, with the programs, and with the ethos of the conference, I think that all comes together in a really high quality way. Which actually brings me on to the next thing, which is the conference itself. And I'm going to be a bit sensitive when I say this, but there are quite a few soft tissue knee conferences in the UK itself.
For sure.
Yeah.
Absolutely. They're much better established. They have a greater depth. Maybe they're 2 days, 3 days even. So this isn't about competition. This is actually about delivering for people who wanted something very slightly different. What's different? Well, we're in the centre of London. We're covering topics at a slightly different level, coming back to trainee, senior trainee, fellow, junior consultant level, maybe consultants who are generalists who have an interest in these. So we are pitching it at a slightly different level to many of the other conferences. And I think every set of organizers, speakers, institutions brings their own signature to a conference. And having been part of the Imperial Furniture for nigh on 25 years, I think there'll be a different flavor to what we're delivering, which is a subtle mix of scientifically rigorous data with hands-on clinical cases delivered by the best.
Yeah. Fine. I think that's where the conference really stands out. I mean, in my very short period of experience, when I go attending a lot of these other knee conferences, they're great. They go really into depth in certain conditions, but it gets lost for people like myself who are probably kind of going into your full-on career. And actually a conference like that is certainly needed just to get that entry. And that's why we have this podcast as well. Hopefully our listening audience would be able to kind of get a lot of that foundation and that grounding before they could probably take on a bigger, much more in-depth conference. So I completely agree that actually that is the way that we are moving forward with it. So would you say then that, So say like a consultant with 10 to 15 years experience, you know, do you think that the things that we bring in this conference will be a little bit too basic for someone like that? Or would you disagree with that statement?
Well, I'm a consultant of over 15 years experience, and every time I go to a conference, I learn something.
Yeah.
I think that depends on the person. There's no doubt we have got the best. We've got the best of the best in terms of speakers. I think the other thing to point out is it's supposed to be interactive. We've got a lot of clinical cases, and this is about audience participation. It's about interaction rather than didactic lecture or even a kind of slightly superior conversation between the elites, which you can get something out of, but also the suggestions from the floor, the questions from the floor being at the forefront, not an afterthought after presentations. I think that's what we're aiming for. I wouldn't say it's unique, but that's the Imperial stamp, because Imperial is all about teaching. I was with Professor Amir Sam, who is our dean of our medical school, and boy, do we have an ethos of teaching in this institution, whether it's undergraduate, graduate, postgraduate. And that teaching is always interactive. It's not I'm telling you stuff. And I want to bring that ethos to the conference.
And I certainly think that was quite unique for me when my first experience last year, which was those case-based discussions brought in by the speakers that we all could just input and chat about. I thought that was actually a really nice touch. For me, I was really a fly on the wall, like just looking at how people debate. But I can definitely tell you, it changes how you think as a trainee, and that was really great for me. But yeah, no, I think case-based discussions are one of the few things that people look forward to at a conference. I think we found that in the feedback as well when we got that. Yeah. And I guess, coming up in 2026, this upcoming conference is on the 14th of January, 2026 at the Royal Society of Medicine. Is there anything that people can look forward to in this upcoming conference? Is there a special theme for it?
So yeah, we're going to do slightly different themes. Always, there's going to be themes about the ACL.
Yep.
We've talked about lateral tenodesis. I think it's the next level of how to improve outcomes in ACL. Patellofemoral instability, osteotomy, and meniscus. I'm sure I've missed a couple of things out, but the theme is about evidence-based excellence in clinical practice in those particular subspecialist fields.
Sure. And with regards to the speakers that are coming, are there any that you're particularly excited towards?
Yeah, I mean, at the risk of incurring the wrath of those that I don't mention, and we have about 22, and I'd love to reel the list off. They're all stellar. But this year we have Sachin Tapathvi from India, who's the program director of education for ISKM, if I'm not mistaken.
Yes.
We have Al Getgood, who is in the Aspetar clinic in Qatar, but obviously he's done a huge amount of work around ACL and lateral tenodesis. We have Andy Williams, who is talking about the people who have really delivered for Imperial.
Yes.
Andy's he's a great friend, and I'm eternally grateful. And so many others. We've got really representation from people who are who have a degree of position in the European Sports Knee Society, in the International Society ISKM, in the Kids Knee group with Nick Nicolau and with Adil Ajwid. We have people from the local London area as well as the UK who really, they deliver not just great practice, but they actually influence policy as well.
Yeah, no, I'm really excited for those speakers as well. Obviously, we've had some of them before for our first conference, and I'm sure they're looking forward to coming back as well. And I guess, so take me as someone who has just come to the conference for the first time. If there was something that you would want me to take away from that conference, okay, make it 2 or 3 things.
Yeah.
what would it be? What would you want to see your delegates sort of take away from the
Yeah.
conference?
At the risk of sounding very, very obvious, the patient in front of you is an individual, and you will see that our experts combine their clinical knowledge with scientific evidence
Mm,
and tailor it to that individual
mm,
to produce a management and surgical plan that is appropriate for the individual.
mm,
That is what I'd like them to take away. Take a history, examine the patient, examine the data, put it against your own experience, and then come out with an answer.
Mm.
So that should be how practice clinic how medicine is practiced.
mm,
But I think sometimes we get lost. We get lost in guidelines and
mm,
policy. We get lost in one randomized trial that shows X.
mm,
We get lost in our local network uh, biases.
mm,
And if we can tease out all of that noise and say, look, this person needs the best result they can get, delivered by the best person at the right time. That's what I want them to get out
mm,
of it. How do I generate that algorithm based on the masters I'm seeing here?
mm. You know, that's such a key thing in soft tissue knee surgery, isn't it? I think I'm coming to the end of mine at where I'm training currently, and I'm starting to realize how personalized that is and how difficult it is to actually make that decision for that patient in front of you. So I think the meeting really helps with that. So no, I'm so grateful, even just to be part of the team. You know, being here as well, and maybe tell us a little bit more about how we can, we can find out more about this meeting, how we can register. You know,
Sure.
yeah.
So you can register at www.imperialsportsknee.com.
Mm,
You can register basically online, okay? And it's delivered through the website. We have some other redirections to websites as well, but that's the main way to register. We've got our own Imperial Sports Knee YouTube channel,
mm,
so watch the caption at the bottom if in case you need the website address.
yeah.
And please let us know if you have any trouble registering. It would be, we'll make sure we correct it.
Definitely. You can let us know in the comments or contact us in any way on our social media platforms on LinkedIn, Instagram, Facebook as well. No, that's been so great. And it's been so nice to hear this from you again. I know you've told me once about sort of the ethos and the vision behind this meeting, but I'm sure now our audience members have caught a sense of that passion, that idea that actually when I come to this meeting, I will come out learning something that I can put straight into practice. This is not something that will completely go over my head. And, I really hope that this can be an ongoing thing.
Yeah, if I may just make one point that I haven't made,
Yeah.
which I mentioned right at the beginning, this will, I think, deliver 70 to 80% of what people need to know for their postgraduate exams, typically in the UK,
Mm.
FRCS, trauma and orthopedics,
Yep.
or knees.
Mm.
So there is an element of exam preparation, if you like, because actually the exams are competence exam.
Yep.
What the examiners are looking for is day one consultants who are competent, who can manage
Yeah.
conditions, not quote individual papers necessarily.
Mm.
So this is about the thinking process that goes behind the clinical scenarios that you get in that exam.
Mm. I would definitely agree with that. Now starting on my part one exam. The other thing I would add on to that as well that you didn't mention is fellowships.
Yeah.
A meeting is always a place where you meet people, you shake hands, and you get to know these people so you can say that here I am. I would love to be part of your unit, to spend a year with you. And I don't think there's any better place than the Imperial Sports Knee Meeting with the people coming.
That's
as
right.
well.
And with my BASC, British Association for Surgery of the Knee hat on, we are now going to have a directory of fellowships.
Mm.
And many of the speakers will be the mentors for those fellowships. So there's no doubt. I can't promise
Yeah,
that
of
if you
course.
come, you get a fellowship, but certainly you'll be able to interact with people who are key to those fellowships.
Thank you so much for your time. And we'll see you around, boss. Thank you so much for your time.
And as always, a great pleasure to be here. And thank you for being an absolute trooper in delivering this as well. Hand it
No,
to you.
thank you. Thank you for all your support. In the second part of this episode, I get a chance to speak to Mr. Rahul Bhattacharya, who is the co-convenor of the Imperial Sports Knee Meeting. He's a consultant knee surgeon based in Glasgow and London, and also honorary clinical senior lecturer at Imperial College London. He serves on the executive committee of the British Association for Surgery of the Knee. I get an opportunity to ask him about what his perspective was about how the meeting started and what were the difficult things for him getting this meeting off the ground. This is my conversation with Mr. Bhattacharya. Hello, Mr. Bhattacharya. Thanks for joining us. Can you bring me back to the time when this idea for the Imperial Sports Knee Meeting came about? And tell us the story of how it all started, or from your side.
And that's really interesting, actually, when I think about how this all came about. It was as simple as a Saturday morning. I was walking on the meadow, which is just downstairs from my house here in Glasgow, and Chinmay Gupte, who I work very closely with at Imperial, phoned me, and we were just having a chat about a meeting that Imperial College wants us to run in sports knee surgery. It was as simple as that. And then we got into the logistics, the details of what this will involve. For a long time, there has been this sort of need or want from Imperial that we run a meeting in sports knee surgery. And there's also been a demand from trainees, from fellows, for various aspects, being one of the colleges that is really into education, into hosting meetings. So that was the backdrop of it. But then I was having, during the discussion with Chim, we went into the details of what this would look like, what the logistics would be, how we would place the meeting. There are so many different meetings out there now. So it is important that you have a need for it, first of all. That is key. And how you place the content of it so that it's relevant. So that was really how it came about. It was an idea that was there for a long time, but it felt right that the forces all came together, the stars aligned, we had the necessary resources. It would be led by Chinmay Gupte and myself together in our roles in the academic side at Imperial College, and the need that the college wants a meeting to be hosted. So all of these stars aligned, and that's how we started. And as we hosted a very successful inaugural meeting this year. So yeah, it's been really rewarding. When I look back to that phone call, if that phone call didn't happen that day, maybe we wouldn't have had that meeting this year. So look, that's how sometimes these things happen. A simple thing like that can be the start of something quite interesting and a journey of a meeting like ISKM.
And for someone perhaps, thinking of starting up a conference, you've got this massive mountain in front of you and your brain is running at 100 miles per hour about the things you have to do. What would be your best advice be? Where do you actually start?
Look, Ernest, that is a really, it's a really good question. It is difficult. Let me be honest, this is not easy, okay? To start a meeting from scratch, we had that phone call, we had a discussion, it all felt great that this would be a nice thing to do, it'd be exciting. But when you come to the groundwork, the logistics, there is a lot. First of all, the program. One of my biggest roles with Imperial Sports Knee Meeting was to write the content of the program. Is to make it relevant, is to pitch it from something that you will attract the audience that you're wanting to bring to the meeting. Okay. So you have to then, when you're trying to set up a meeting, understand where your content will sit with other existing meetings or conferences so that, it's relevant and is a place for all the meetings. And so, for example, for ISKM, we wanted to have the program such that it is relevant for middle stage trainees who have an interest in sports knee surgery, going up to senior trainees who want to be sports knee surgeons, then to fellows just before they start a consultant career, to junior consultant, to experts in sports knee surgery. So we built the program such that it starts from basic topics, going on to really advanced meet the experts type sessions, which is discussing the nuances and finer details of sports knee surgery. So that was the first thing, to write the program. And then, me and Chim, we worked really hard to get together really to build that. The next thing is sponsorship. When you want to run a big meeting, you need money, you need sponsors, you need to have multiple meetings. We have hosted multiple meetings with various sponsors to see what the interest is like. And luckily, we've had a great amount of interest from the sponsors. They were all bought into the concept and the idea of Imperial Sports Knee Meeting. And then they funded it, So that was the second thing, but that involves a lot of discussions and planning as well. The third thing is to have a management group who can manage the logistics of the meeting. Me and Chim are both busy practicing clinicians, and we've got an academic work on the side. So it's difficult to go through every single logistical detail. So that's where Clockwork played a really, really important role. They're an extremely experienced, events management company running all these conferences. We work very closely with them in the British Knee Society at Basque. So they were very keen to run this meeting, and they're very experienced. So they went down the final logistics in terms of setting it up and everything else from that side. So we did that. And then, next thing is to have the team. The team is really important. You can't do it just with one or two people. So you guys, for example, you've played a really important role in dealing with the awareness, running the social media side of things. You've developed your own team. You've had your own vision in bringing additional aspects to the meeting, a younger flavor, a trainee's perspective, all of those things. And that's been invaluable to our team and to our meeting. And finally, last but not the least, the vision is really important. You need to have a vision, an immediate plan, a midterm plan, a long-term plan of where you want to see all of this progressing. If you don't have a vision, you can't run this in a sequential manner to really build on what you're trying to develop over a number of years. I must say, Chim Gupte initially had the idea. He is an academic at Imperial for a very long time. I did my MD under Chim in 2016-17. I've had a very close working relationship with Chim over the last, 10 years now. And he's had this vision for a number of years. We work very well together, and then, I've added my ideas to it, and we discussed all of the ideas, pros and cons, but we built that together. But I have to give a lot of credit to Chim for having the idea, the vision to really getting this off the ground. And then we've all contributed to this to make it what it is today, and hopefully continue to work on this over the next many years, which I'm excited for.
And what would you say was the biggest challenge getting this meeting off the ground for you?
The biggest challenge with the logistics, the timings, making sure that within a certain specified amount of time, you have the program ready. You have the sponsors to actually sign so that they can get the funding to get the meeting off the ground. If you don't have that, you could have a program, but not the funding. And then to get the faculty together, that's a big responsibility to ensure that, you get really high quality faculty who can deliver the quality of the content. But ultimately, you can have a great idea, but the quality of content's not there, then it'll not be great. So I'm eternally grateful to all the faculty who've contributed to ISKM in the first year, and people who've agreed to come to it again, giving up their time in the second year that we are planning. So, I'm very grateful for them to come and, share their expertise. And, both me and Chim, we make sure that, we make the experience worthwhile for them so that they enjoy it. They speak on areas that they, are comfortable with or they're experts in. And then also make their overall experience good and, ensure you have a faculty dinner, have everything around the meeting that makes their experience coming to central London for a day in the peak of winter a good one.
No, that's really great. I want to look forward to the next meeting. I know you're heavily involved in planning that as well. Oh yeah. Is there anything that's going to be different compared to the first meeting?
Yeah, so look, we have again worked really hard on the content, on the program to make sure there's no repetition from the first year. So really touch on the areas that we haven't touched on. So there'll be a more focus on osteotomy this time, for example. We didn't really go into details of osteotomy in the first meeting. And then all the areas, the broad areas that we did, that still remains the same, but really to touch the areas within the subheadings that we haven't done. So we still have sessions on ACL, we still have sessions on meniscus and cartilage and the patellofemoral joint on the pediatric sports knee problems, or we'll focus on the areas that we didn't focus on in the first meeting. And also get in some rehab talks to ensure that physios are more engaged with it as well. As I said, you know, rehab is extremely important for success of patients in sports knee surgery. So their involvement is really key for us. So we want to increase that content. And also, for example, we want to get in, trainees who will be there having an understanding of how it is to secure a good sports knee fellowship in the future. Fellowships are key. Personally, the fellowship I did, both my fellowships taught me a lot, but particularly in sports knee surgery, the one I did in Coventry under Tim Spalding, Pete Thompson, Nick Smith, Andy Metcalf, Fazil Shah, the entire team, even I would mention, there's a surgical care practitioner there called Adrian Davidescu, who is extremely experienced in sports knee surgery. I picked up a lot of tips from him that I use routinely in my clinical practice. So I think fellowship is key. And how do you set yourself up for a good one? How do you plan one? Because it comes at a time of life where it will destabilize you a little bit in terms of geography and your personal life. So we want to bring in some talks from people who can guide trainees or, people wanting to do sports knee surgery in the future. So all of these things will bring a slightly new flavor, a different flavor to ISKM compared to the first year. And I also want to mention that we want to increase our digital presence, our digital content with the ISKM podcast, something that you've been heavily involved in setting up and running. So I would flip this over, play host for a little bit, Ernest. I've answered a lot of questions today. So I want to ask you the question. So what is your vision with the ISKM podcast and the digital content in 2026 and then in the future?
So what I would say is that just imagine that before you walk into your first ever soft tissue knee placement, you could be an ST3 or you could be an ST4, and you will be able to walk into that placement and not worry too much about learning the vast amounts of stuff you have to learn at soft tissue knee. You could go in there, hit the ground running, impress your boss, and just have a good time on that placement. And I think that that's where the podcast really comes in.
Great.
There isn't a podcast out there currently that is just solely focused, not just on trainees or say junior consultants or fellows, but just focusing very specifically in the UK on sports knee surgery. And for me personally, this really resonates with me because of the vastness of material. I want to do soft tissue knee surgery, but man, the mountain I had to climb just to get to the knowledge base to be able to enjoy myself was large, and a lot larger than I thought. I wish that when I was a trainee, there was a resource out there that I could use to actually have a proper conversation with my boss about certain things about soft tissue knee. And that's where this podcast really comes in. It's about science. It's about information. It's about getting people on this podcast who are experts in their field. And I think that's where the sports knee meeting really comes into its own, because this podcast really is an extension arm of that. It's to take some of these talks that are 8 minutes to 10 minutes long, and then having the opportunity to just elaborate on them in a relaxed setting. I think that's really key for me. But also in the future, what I want to see as well is that I want to see people come on the podcast to not just talk about science, but to talk about things like leadership, to talk about things like resilience. Because I think the thing that we don't like to approach, especially as doctors, is that we think that we should have it all together. And let's all be honest, none of us do. I'm moving into this time where I'm applying for fellowships, and I've got a 2-year-old son, and I've got another child coming. The thought about having to be able to go for these fellowships and then come back and being ready to be a consultant when you step into that role eventually is very stressful for someone like myself. And I think hearing from someone that has gone through that same sort of process helps us all to kind of relate to each other a lot better. And finally, on top of that as well, is that I don't just want doctors, I don't just want surgeons, I want physiotherapists on here. I want people who have been through injuries and having to go through that rehab. What does it feel like? I want patient experiences as well to help us all just become better surgeons, to be more compassionate to our patients, and to also grow a community that we can all support each other educationally, scientifically as well. So that's my vision for this podcast. And I think that with that sort of vision, I think we can build something that's really great and really useful for generations to come for knee surgeons as well.
Ernest, that's fantastic. I must congratulate you for setting this up, working incredibly hard behind the scenes and doing this. I think, like you say, should be really good educational content for people, which should be freely available, who are interested in sports knee surgery. And you've done a great job at setting up your own team. There are two medical students I know working very closely with you, who we should mention is Ashish and Chevy. Both of them, done really well behind the scenes with you, setting this whole content up and making sure that this is a success in future. So look, congratulations, and I'm sure that this will just build from strength to strength and add to our team. As I say, I am very grateful for Chinmay Gupte overall to have a vision for ISKM and working very closely together to develop this podcast. And then also to you guys to have this whole team where we all have our own aspects that we lead and we develop to really make this meeting a success in the future. So I can't wait for 2026 and the future editions as well.
I think for our general audience out there as well, who are wondering when the next meeting will be, it's on the 14th of January in 2026 at the same place where we held it last year, the Royal Society of Medicine. And I'm also going to put something out there as well, that this is the first time we are actually going to be opening up to abstract submissions for an e-poster.
Yeah.
That's currently open. And I would really encourage people, if you have a piece of research in soft tissue knees, to submit your abstract, get a poster out there. This is a national course, a national conference where you can actually get something out of and come and, listen to really world-class quality speakers who are experts in their craft, just talk about things that they love. I think it's going to be an amazing day. 14 January, I'm really looking forward to it as well. Thank you so much again for your time that you've given us. I know you're a busy person, but thank you. Thank you so much, and I'll catch you up soon.
Thanks, Ernest. Pleasure. Thank you.
All right, see you.